Restless legs syndrome. The best treatment options. Restless legs syndrome, also known as Willis-Ekbom disease, is a common condition of the nervous system that causes an overwhelming, irresistible urge to move the legs. It can also cause an unpleasant crawling or creeping sensation in the feet, calves and thighs. The sensation is often worse in the evening or at night. Occasionally, the arms are affected too. Restless legs syndrome is also associated with involuntary jerking of the legs and arms, known as periodic limb movements in sleep. The symptoms of restless legs syndrome occasionally, while others have them every day. The symptoms can vary from mild to severe. In severe cases, restless legs syndrome can be very distressing and disrupt a person's daily activities. Symptoms of restless legs syndrome. Restless legs syndrome typically causes an overwhelming urge to move your legs and an uncomfortable sensation in your legs. The sensation may also affect your arms, chest and face, too. It has been described as tingling, burning, itching or throbbing. A creepy crawly feeling. Feeling like fizzy water is inside the blood vessels in the legs. A painful, cramping sensation in the legs, particularly in the calves. Periodic limb movements in sleep. PLMS can be severe enough to wake up both you and your partner. The involuntary leg movements can also occur when you're awake and resting. Causes of restless legs syndrome. In many cases, the exact cause of restless legs syndrome is unknown. When no cause can be found, it's known as idiopathic or primary restless legs syndrome. Underlying health condition. Restless legs syndrome can sometimes occur as a complication of another health condition, or it can be the result of another health-related factor. This is known as secondary restless legs syndrome. You can develop secondary restless legs syndrome if you have iron deficiency anemia. Low levels of iron in the blood can lead to a fall in dopamine, triggering restless legs syndrome. Have a long-term health condition, such as chronic kidney disease, diabetes, Parkinson's disease, rheumatoid arthritis, an underactive thyroid gland, or fibromyalgia. Are pregnant, particularly from week 27 until birth. In most cases the symptoms disappear within 4 weeks of giving birth. Triggers. These include medications such as some antidepressants, antipsychotics, lithium, used in the treatment of bipolar disorder, calcium channel blockers, used in the treatment of high blood pressure, some antihistamines, metoclopramide, used to relieve nausea. Other possible triggers include excessive smoking, caffeine or alcohol, being overweight or obese, stress, lack of exercise. Diagnosing restless legs syndrome. There's no single test for diagnosing restless legs syndrome. A diagnosis will be based on your symptoms, your medical and family history, a physical examination, and your test results. Your GP should be able to diagnose restless legs syndrome, but they may refer you to a neurologist if there's any uncertainty. There are 4 main criteria your GP or specialist will look for to confirm a diagnosis. These are an overwhelming urge to move your legs, usually with an uncomfortable sensation such as itching or tingling. Your symptoms occur or get worse when you're resting or inactive. Your symptoms are relieved by moving your legs or rubbing them. Your symptoms are worse during the evening or at night. Blood tests. It's particularly important to find out the levels of iron in your blood because low iron levels can sometimes cause secondary restless legs syndrome. Low iron levels can be treated with iron tablets. Sleep tests. If you have restless legs syndrome and your sleep is being severely disrupted, sleep tests, such as a suggested immobilization test. The test involves lying on a bed for a set period of time without moving your legs while any involuntary leg movements are monitored. Treating restless legs syndrome. Mild restless legs syndrome that isn't linked to an underlying health condition can be managed with just a few lifestyle changes. If symptoms are more severe, medication may be needed. Restless legs syndrome caused by an underlying health condition can often be cured by treating that condition. For example, iron deficiency anemia can be treated by taking iron supplements. If it's associated with pregnancy, it usually disappears on its own within 4 weeks of the birth. Lifestyle changes. A number of lifestyle changes may be enough to ease the symptoms of restless legs syndrome. These include avoiding stimulants in the evening, such as caffeine, tobacco and alcohol. Not smoking. Read more about quitting smoking. Taking regular daily exercise, but avoid exercising near bedtime. Practicing good sleep habits, for example, going to bed and getting up at the same time every day, not napping during the day, taking time to relax before going to bed, and avoiding caffeine close to bedtime. Avoiding medicines that trigger the symptoms or make them worse, if you think medication is causing your symptoms. Painkillers. A mild opiate-based painkiller, such as codeine or tramadol, may be prescribed to relieve pain associated with restless legs syndrome. Aiding sleep. If restless legs syndrome is disrupting your sleep, a short-term course of medication may be recommended to help you sleep. Cardiovascular diseases. Recent research found people with restless legs syndrome may be up to twice as likely to develop cardiovascular disease, such as coronary heart disease or stroke, compared with people who do not have the syndrome.